I'm Danny Davis. My guest is Roger Briggs, founder of Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona. Welcome, Roger.
Thank you. It's good to be here.
In this segment, we're talking about obstructive sleep apnea. What is it?
Yeah, obstructive sleep apnea has, it's one of those things that people can be affected by it, not be aware of it, because you're asleep. And it's where the airway becomes obstructed and prevents you, even when you're trying to get breath, it prevents the airway from being able to flow. And that's why they call it obstructive sleep apnea. That means no breath.
The CPAP device is a standard treatment, but it can be difficult to use, right?
Yes, traditionally, obstructive sleep apnea, there's a couple of types of apnea, but obstructive sleep apnea is where the airway is obstructed by something that needs some positive pressure. So everybody's familiar with that big old mask that you wear. It's called a CPAP. It's been around since about 1988, very effective. In fact, it's the gold standard for treating the obstructive sleep apnea issues. But it's grown now because that sometimes is very difficult for a patient to be able to wear that. It's hooked up to a pump and there's airway. It's not very attractive. It's difficult to travel with. So there's a lot of reasons why people can become intolerant or just not able to wear a CPAP. And so dentistry has gotten involved with it because we can make a particular mouthpiece. Actually, there's about 94 that the FDA has approved for use in holding the jaw in a position that opens up the airway so that even though the person's asleep and unprotected, their airway remains open and they're able to get proper oxygenation.
I've seen mouthpieces available over the counter, but it's important to have one fitted for it to work properly, right?
You know, it's one of those things that I guess you'll find over-the-counter whitening, you'll find over-the-counter this and that. But it really is a pretty challenging science that actually the way we're practicing taking care of our patients with obstructive sleep apnea, I work with a team of sleep disorder specialist doctors. I have an ear, nose, and throat, a couple of ear, nose, and throat doctors. Actually, we work with neurologists, psychiatrists, because the whole sleep apnea thing is a pretty complex thing, and it's life-threatening stuff. It's people, if they're not getting proper sleep, you can pretty much make a terrorist tell you what you want to hear. And if a person's not getting proper sleep, it can put them into depression, create all kinds of mental problems. So it's not something that I would tell people run over and buy something from the TV or at your local drugstore to try to treat obstructive sleep apnea.
Is this problem difficult to diagnose?
You know, there's only one way to really diagnose it. When we do a dental exam with a patient, obviously we're looking for all the typical dental problems of decay or gum disease. But there are signs in a patient's oral cavity, in their throat, even the tongue, that will give us a pretty good indicator that a person has got some issues with obstructive sleep apnea. Even grinding of the teeth. I can look at an 8-year-old and I can see the amount of wear they have on their 6-year molar, and I don't have to guess. I can probably look back there and find some oversized tonsils. And they cause obstructive sleep apnea in their child. It makes them grind their teeth. So we see things orally that help us to make a pretty educated guess that there's an obstructive sleep apnea problem. But until a sleep study is done and we monitor that sleep study, we can't confirm that there is a diagnosis of sleep apnea.
Because sleep deprivation affects appetite as well, these overweight patients are fighting an uphill battle, huh?
It's interesting, some of the patients that I've treated, and studies have shown that once we get their obstructive sleep apnea under control, without really changing anything else in their life, they'll find at the end of a year's time that they've lost 10% of their overweightness. So they get more energy, they don't feel like they eat as much to keep themselves moving, they sleep better, their hormones become balanced again, and so their body just naturally, because it's getting that sleep that's necessary for us to regulate our electrical system, our hormonal system, all that makes the weight gain tend to just go back to a more normal weight.
My guest is Roger Briggs, founder of Briggs Family and Cosmetic Dentistry in Scottsdale, Arizona.